Lovely. Okay, great. So this is the first one we've done for the whole network. Normally our meetings are for the advisory group, and we've got a couple of groups, but I've invited the whole network along because we've got some speakers today which I'm hoping will be useful to some or all of you. Okay, so just give you, for the new people here, I'll just give you a quick overview of what the network is. And so we've been funded by Mind, and they funded 9 regional networks across the country to bring physical activity and mental health organisations together. Each network's led by a regional hub, and for the Southwest, that's us at Active Dorset, but we're just coordinating it. You know, it's not our hub, we're just coordinating it for everyone else, and it's a place to share contacts and best practice and learnings, both positive and negative, from past experiences, and that's focusing on the benefits between beneficial links between physical activity and good mental health. Okay, so today we've got Headstrong Project here, guys from that. Annie and Naomi will be dropping in a moment. Annie's here, Naomi will be popping in to discuss some work that they've done with the 5 Ways to Wellbeing programs with schools. And then we've got Clive from Active Dorset, who's the diversification manager, and he's going to discuss physical activity resources, thank you, resources for the physical activity workforce. Okay, so I will stop sharing my screen, and Headstrong, does anyone have any questions before we start?
Not yet.
Not yet. Good. Yeah, there will be time to ask some questions, hopefully between speakers, but if you've got any as people are speaking, if you pop them in the chat box, Clive, Annie and I have all got access to them, so we can have a look and then we can pass those questions on at the end of the presentation. Okay, right, Headstrong guys, off you go.
Dan, take it on. Take it on.
Fantastic. Well, first of all, morning everyone, and thank you for the opportunity to share what we've been doing with you guys. It's really appreciated. I just want to talk briefly about what we do, what our aims are, what we have done, and what we believe we can offer, let's say, going forward as well. Alex, are you able to share the PowerPoint at all?
Hold on, I'll get there. I'll work it out.
So whilst we're looking at that, I'll just briefly talk over who's in the project and how it started, really. So the Headstrong project started off with 4 members, myself, Adam Harvey, Alex, who's on the call, and Sophie. Now all 4 of us grew up in Shaftesbury, all went to Shaftesbury School, and we were all doing our own individual things regarding mental health. So Adam was blogging about his own personal experiences. I set up what we now call our social events, but I did it off the back of my own, off my own back, which was just basically an opportunity for guys to meet in. I mean, I did the first one at the Cozy Club, so just a pub / restaurant. Come along in a fairly comfortable environment and talk openly, or listen, or just gain experience from other people, really, about how they may deal with mental health issues, and to really bounce ideas off each other, really. Me and Adam then saw each other's work and what we were doing through social media. I thought it'd be a great idea to get together and maybe see if we can do something as a team. Alex then approached us. Alex has his own company called Play Motion, and he specialises in films, videos, etc. And he wanted to make a film regarding mental health. and wanted it to be sort of raw and powerful, and he had a vision for that. So he approached us to see if it's something that we could all work together on, which we did. And then Sophie got involved through sheer passion and willingness to want to be involved. And also we could have done with someone keeping us in check, to be honest with you, as well. So so she came on board from there. We have since then added 2 further people as trustees to help us with social media and with new ideas. So we are now a team of 6. So we've managed to recruit Rebecca Robinson and Richard Mullins as well, who again have done great work in the community in Shaftesbury, and offer a lot to us, like I said, with new ideas from there. So it all started, as I said, I've given you an idea of what we were doing individually and how we all came together. And again, it stems from a passion and a want to improve mental health for people through our own experiences. Everyone's experience is different. We can all learn from each other, from each other's ideas, experiences, what works, what doesn't work. And that's where the idea was born. Initially, we wanted to kind of create a support system. We had quite a vast goal, I would say. So we initially wanted to be a support system for people to feel like they could turn to speak to confide in us or speak if they wanted to. We also wanted to bridge the gap between the GPs and the general public. As you know, obviously there can be, especially with mental health, if you go to a GP, they can often refer you to someone else or give you a leaflet and say see you in 6 weeks, because they're obviously fairly high pressured as it is. So we wanted to be that gap between, so people could come to our events and feel like they were managing in between before they sought help from professionals, really. So that was our initial goal. Some of the ways we've done that through different events, as I mentioned earlier. So as a team, we set up social events where we released the showing of our first ever film. These social events it's an idea basically that people can come together in a safe environment, have a couple of drinks if they wish, and just it's almost like a networking event, really. Just really walk around, have a chat, and ideally keeping mental health as the main subject. The first one was very successful. I'd say the first one had between sort of 30 and 40 people attend, which was good for our first event. Since then, we've held pub quizzes as well. Who doesn't love a quiz and the opportunity to win raffle prizes, etc. And also it's a good way for us to raise funds to help hold these events. I'll give more information later, but we've been quite lucky with people allowing us to use their venues for free, which has been fantastic and a real help. So but yeah, quizzes is just another way we can raise funds for further events in the future. We've also set up a shop, which again I'll divulge more information on later, but we set up an online shop offering different types of merchandise. Again, that can raise awareness. It also generates funds for us, again, like I said, to hold further events, but we also aim to donate a percentage to other charities, organisations, people that need help as well. So that's the aim there. We've also, as I said, created a couple of films now. The first one just really was a raw and powerful one that sort of tried to portray how some people may feel and how their mental health may be affecting them. We didn't want it to be cliche, I think is the word. We didn't really want, lovely soft music and waves crashing on the beach and someone looking to the distance. It was raw and powerful, and some of the actors, I think, actually got a little welled up during filming. So it was a great film. And also we tried to help through, like I said, sharing those on our social media, people to watch and people can relate with it to them. And we've also done as much as we can through social media as well. COVID has obviously knocked us for 6, and like it has with everyone else. So we've had to really adapt in how we can try and help people and what we can try and do. And what better way than social media? Everyone spends a lot of their time on their phones these days, Facebook, Instagram, Twitter, etc. So so yeah, we found that we held little events, competitions for people to enter, things for people to engage in, which is the main thing, because obviously during lockdown you feel quite isolated. People can start to struggle more. So the key was to have something that people could really get involved in. We, after a while, after hosting these events and bits and pieces, the majority of us in the Headstrong project, we're fairly sporty anyway. So we do like to keep fit, and physical health, as we know, is strongly linked with your mental health as well. And we just found ourselves naturally going down that route. We just found that a lot of what we were suggesting to people became directed at your physical health as well. Not necessarily keeping fit in terms of a highly trained athlete, but certainly just keeping active. So a lot of things we held were ideas of going out walking, etc. So we've now sort of channeled our efforts certainly down that route of trying to keep people active through different ways, and any way that we can help promote that to help keep your mental health in good state. So yeah, as I said, that became our main focus from there, really. We, off the back of that, tried to host boot camp sessions. So we've collaborated with Rivers Meet, which is a leisure centre in Gillingham. They allowed us to host. We had 2 boot camps. So the idea was people pay for a 6-week boot camp at a discounted rate, which Rivers Meet kindly did for us. The PT there would hold a sort of HIIT session, if you like, where people could attend, and then afterwards the premise was to have a coffee afterwards, so people can feel free to share and chat and talk if they want to. Again, COVID caused issues there, so we actually only got into I believe it was 2 of our bootcamp sessions before, unfortunately, we had to stop. We had planned to obviously relaunch, and we will do once we're allowed to continue those, but they proved very popular. We also started a running club as well, so they meet every Monday evening at 7:30 in Shaftesbury, and yeah, the guy that runs that for us, he basically plans a route each week, and people can come along and it's, again, at your own pace. The route's predetermined, so you get all sorts of different levels. And I think we've had between 15 and 20 people, I believe, that have attended those events, which is, again, fantastic numbers, really. So through COVID, again, like I said, we really pushed all of our work through social media. We tried to be as engaging as possible, especially during lockdown 2, because we really focused on the mental health aspect, on the physical health aspect. We were doing things such as a collective amount of steps to reach in a day. We were posting workouts for people to do at home. We were posting, asking people to go along and take pictures of themselves, like a selfie on their walk that they did that day. What else did we do? We had another task where people had to find something on their walks for each of the letters within Headstrong. So, for example, H for horse, you pass a field, take a picture of a horse, send it to us. So things like that. So we're just trying to be as engaging as possible, and keep people active at the same time. One thing we're looking at going forward as well is trying to collaborate with as many people as possible. So we've come up with an idea, and we've approached different organisations. For example, a Zumba class in Shaftesbury, and we're trying to collaborate with them in a way that if someone, for example, was to come to the class wearing a Headstrong t-shirt, they may get a discounted rate, things like that. So we're trying to create as many collaborations as we can with local organisations. we work closely with Shaftesbury CrossFit as well. And again, we've filmed at their location, so maybe there's again an opportunity to do something like that there, where we can collaborate and give, like I said, some small discounts or something like that for wearing our merchandise, which would be great. Certainly spreads the message and shows that we're supporting local businesses as well as people in their mental health. So. So going back to our media, and as I've said, we tried to keep spirits high throughout the social media. Like I said, COVID has made it very difficult to go out and do what we want to do. We've still been planning ideas in the background. I know Alex has been working really hard to get our third film up and running. Our second one was, which again we're happy to share, I'm sure you can find on our social media pages.
I think we're going to share it in a minute, Dan.
Oh, lovely. Okay, perfect. So the second film, as you'll see, is regarding physical health and mental health being so closely intertwined, interlinked. And the third one that we're going to be looking at going forward will be the impact of sort of social media and things, and getting children active.
We have I've got a pitch for that, so if anyone sort of wants to have a look at that, I'm happy to share if anyone's interested in seeing that. Yeah, that's all I wanted to add for
that. We've started to branch out and collaborate with different people outside of North Dorset as well. As I mentioned, we're heavily Shaftesbury based, all living there, well, all growing up there and having friends in Shaftesbury. We've managed to collaborate with people called Dodger Sevens. So they're based in Northampton, and they overcome their mental health battles through playing rugby. Again, Alex has been up there filming a documentary called Blindside, which again we'll be sharing on our social media. Yeah, it's a fantastic idea. People just really sharing their raw experiences with their own mental health and how they overcame their issues through playing rugby, through having that team around them. So it's a really interesting documentary, and again we're, like I said, collaborating with them in any way that we can, and hopefully we can educate people and give people that the ideas of what works for them, because it then may help them as well. So
should we try and share the film, the commercial?
If you can, mate. Yeah,
I'll give it a go. I found it on my Facebook page, so
awesome.
I will have a look and see if I can share that for you. Just a quick aside, Claire and Annie have both said yes please to sharing the pitch.
Yeah, I saw the little message come up, so I'll share that. Has everyone got like an email address in here that I can sort of access and send and stuff? I'm not Zoom proficient, not really. So I'll try and sort that out at the end of the call.
Cool. If not, people can send it to me and I will share it, hopefully. This is the one, guys, isn't it?
Lovely, thank you for sharing that. Yeah, so as you can see, Alex's work is fantastic, and without that we wouldn't have been able to hit and share and hit a wider audience as we would have liked. So yeah, it's fantastic, and like I said, looking forward to seeing what comes in the future as well with these new pictures and these new ideas. So going back to our work there. So as I mentioned, we've gone down the route of physical and mental health being so intertwined, but we still want to remain strong and remain true to our roots as well, which our ultimate goal is to support people who feel like they're struggling with their mental health. So we do that via, like I said, basic chat and conversation. So at these events that we set up, i.e. boot camps, the running club, people can feel free to talk if they want to. We're not qualified in any way, shape or form, but we certainly are able to signpost, and we're certainly there just to be an ear for people to, to talk to should they feel like they need that support. We've noticed that obviously through lockdown, people have tended to send us messages through social media. So lockdown 1, we received a lot of messages of people just wanting to reach out and talk. Lockdown 2, not so many, but it shows that what we're doing, people felt that they could reach out to us, which is fantastic. We had our first drop-in, we call it drop-in, I don't know what, we probably could think of a better name for it, to be honest with you. I think we called it the 7:30 Club in the end. But we had our first one last night, where people, it was essentially a drop-in, pop over for a coffee in a neutral venue. The charity Hope allowed us to use their facilities for that. So people could turn up, have a cup of tea and a coffee, and a good old chinwag or a chat about how they're feeling and what they're going through, etc. We're due to actually catch up tonight about how that went. I know that there was a good turnout, and I know that there's been a few messages flying about in the WhatsApp group today to say that certainly at least one person came out of it feeling that they got something out off their chest and feeling good. So so we'll continue to do that every Wednesday going forward. Like I said, that is our main goal, is to help people. So like I said, we want to remain true to that, and not everyone will feel that that the drop in or go into these boot camps, etc., is going to be that way for them. But I said, if we can offer as many different ways that we can help people, then that's great. So just going back to our merchandise as well, we have tried to release clothing line closely related to fitness. So the material of the t-shirts that we offer, for example, are your typical fitness t-shirts. They obviously branded with our logos on the chest, with hashtag Be Headstrong on the back, and our badge on the sleeve. It's been very popular, very popular. We only got a few samples in originally, and they were gone within a few days. So we're trying to obviously expand our range and the types of clothing that we're able to offer, and other merchandise as well. There's talk about water bottles, for example. We've talked about caps and hats and hoodies and t-shirts and all sorts, just as wide a range as we can. Obviously, that branding encourages questions from people. I know Adam went to his son's football on Sunday, and he wore the hoodie with a gilet on, and only the badge was showing on here. And someone said to him, "Oh, what's that badge all about?" And again, so just really raising that awareness and brand recognition, and being able to sell what we do to people, so they know that we're there should they want that support. So that's what we're ultimately here for. Again, the percentage of the funds go back into what we are trying to do in terms of setting up our own events, be it hiring halls, etc., or needing to buy refreshments, whatever it is. So some of it goes back into that, and other parts of it is going to go back into other charities, organisations locally that need the support. And again, if we can collaborate with those to create events together, then fantastic. So offering as much support to people as we can. We've also managed to get sponsorship with a local football team down in Totton, which is great. So again, we'll share the pictures of that later. But it's got Be Headstrong written all over the football kit, which is again amazing to see. And I'm heavily involved with the Shaftesbury Football Club, and we hope to have our name on warm-up tops and across the hall, etc. there. So yeah, so obviously the main point of this picture, this discussion today is obviously to let you know what we do. Hopefully I've managed to explain what we do in quite a bit of detail, so sorry for going on too much, but again, we want to engage and collaborate and grow with as many people as possible and hit wider audiences in different counties. Like I said, we're heavily involved in Dorset. I myself live in Salisbury, so trying to do stuff in Wiltshire as well. Alex has been working with the Dodgers in Northampton, so again, we want to just, there's no end to how far and how big this can possibly get. Yeah, obviously we can work together with different ideas. Everyone's got fantastic ideas. So yeah, the more we can collaborate, the more we can work with people, the more support we can offer, the better. So again, thank you everyone for this opportunity. We do really appreciate it. Obviously, any questions, please let us know. Anything you want us to share with you, we can. And yeah, give us a follow on social media to see what we're all about. Thanks very much.
Stick my video back on now. Thanks, Dan, for that. That was really good. Thank you. Thanks, Alex. Does anyone have any questions? There's nothing in the chat box other than a couple of people asking for the CYP pitch. But anybody got any questions for Dan and Alex?
Yeah. Just a quick one. Just what sort of age range are you attracting at the moment to your sessions?
So a real range, to be fair. Again, I'm not sure what happened with the drop-in last night. We do need to catch up on that tonight. But certainly the running club, vast range. So I think we've had people that sort of late teens, early 20s, right up to, I would say, between sort of 35, 40, something like that. So a real range. And again, we're open to anyone that wants to come to these events that we host.
Okay, thank you. Anybody else? No, we're all good.
Can I ask, in terms of the people that engage with your sessions, are they under secondary mental health, or are they mainly kind of through their GP, or how do people find you, and what what level of care are they receiving from elsewhere?
Yeah, so it could be a real range. People don't necessarily have to divulge if they don't feel like they want to. I'm sure that a lot of people may be sort of just at home feeling the way they do, and that this is just the way they come across us on social media. We work closely with the Blackwell Vale Partnership as well, which is the GP in Shaftesbury. So we've spoken to them there. Again, I know that they've been sharing our work and posters, social media posts, etc. So honestly, it's such a range. It's such a range. People come from all over, like I said, whether they find it themselves or it's shared through the GPs.
Okay, thank you. Yeah, I mean, I think that's really, really important that people can access these types of sessions regardless of where they sit in terms of their mental health and the support that they're getting. And I think that's what we found. That I work with people in secondary mental health, and once they're discharged back to their GP, all these lovely sort of therapeutic things that were there for them are taken away. So there's got to be some real changes around mental health and the services that allow some sort of flexibility with people to be, depending on what side of the line they're on at that particular point and their need. So there are some changes that are coming about from what I've seen, but it's good to see that you've got that sort of flexibility, so you should be able to fit in with a lot of future sort of frameworks around mental health. So that's so that's really positive.
Oh, fantastic. Yeah, thank you for that. Really appreciate it. Yeah, completely agree. Like I said, we're not bound by any particular rules. We can be as fluid as we like and help as many people as we can.
Okay, that's great. Thank you, Paul. If there's no more questions, I will we'll move on to Annie and Naomi to talk about the 5 ways to wellbeing stuff that they've been doing.
There, hopefully I'm unmuted. Can everyone hear me okay? So Annie is going to try, she's doing the share the screen and going to go through the PowerPoint, and then I can just talk, and then she's going to fill in any bits that I've missed, and also then we'll both answer questions. So can everyone see the screen, the slides? Yeah, I can't see anyone. So Melindy, is that all okay? Can everyone see that?
I can see it, so I'm assuming everyone else can. Yeah.
Brilliant. So we're looking at obesity, health and wellbeing of young people in mid-Dorset. So this came out of, I'm just escaping so I can look at my own PowerPoint, which should be much more helpful for me at the moment. Yeah, so it came out of some work. When the primary care networks were set up last year, they were given some money towards doing some prevention at scale work. Lots of primary care networks did some fairly simple pieces of work. When we looked at our health needs of the population within mid-Dorset, what came up was actually obesity is quite a big issue for us in, well, not in mid-Dorset, right across the country. We're kind of similar rates to the rest of the country. But actually, when you look at population numbers and a preventative measure that we could start to work with, obesity seemed to be the big thing to look at. As we know, obesity is a huge issue to deal with and very complex in its pathways and functions. So we were looking, therefore, at the health and well-being of children and young people. And actually, by looking at it from that angle, suddenly we got an awful lot more buy-in. If you can move to the next slide. Oh, I should, whilst Annie moves to the next slide, I should just say that I work for Public Health Dorset, and yeah, so that's why I've been working with primary care networks. So, sorry, I'm just moving my slides as well. We came up with the idea of what we wanted to do was improve the health and well-being of children and young people in mid-Dorset, but through joint working. Obviously, there's no one organisation, it's kind of all working together. As kind of Dan was talking, it's kind of working with the different things and different groups that you've got that are already connected. And the aim was to promote healthy lifestyles through increased habitual exercise, promotion of healthy foods and well-being. So we can move to the next slide. That just gives us a quick idea of the numbers of people we were looking at. It's kind of about, we've got 2,500 children around aged under 5. I think it comes out to about nearly 9,000 young people under 19 years old. So this is a large number of people that we're kind of working with. Now, of that, if you can move to the next slide, Annie. The next one, hopefully you're seeing prevention at scale, overweight and obese children in mid-Dorset. So at the moment, our reception, so that's sort of year 4s and 5s, 30% of those children will be overweight or obese in mid-Dorset. By the time we get to year 6, that's moved up to 41%. This is using the NCMP data that's collected each year nationally. And wasn't it, that's a lot of young people that already, the long-term health impacts, and we know that the long-term health impacts of obesity, we've got the diabetes, hypertension, etc. But we also have, linked in with this, mental health. So a child that's obese is more likely to be bullied, they're more likely to have low self-esteem, they're less likely to be able to be physically active. There's so many impacts. So we felt this was something really important to work with. So if you can move to the next slide, Annie. Thank you. So health and wellbeing relationships. We know that weight is dictated by our physical activity, but also our mental health. And then I've put diet right in the middle of that, because actually that kind of impacts on all of those factors as well. But so that was the kind of health and wellbeing wheel idea concept we were thinking about. And then it's like, well, how do you address that within a school setting? We know that 1 in 10 young people will experience mental health issues. We know that 4 out of 5 young people aren't doing enough exercise. So if you add those two together, that is going to impact on somebody's weight. And we live in a very obesogenic environment. It's harder to cycle places. It's just, there's more food, people drive more. The foods that are pushed are often high sugar, high fat foods that have very little nutritional value for people. So we decided we'd pull some stakeholders together. So that will be on next slide. And what we were absolutely blown away with was the number of stakeholders that engaged. I think health and wellbeing was much more attractive than a title of obesity. So that really helped. So we had the primary care network, both the clinical lead and admin came along for that. We had school nursing, we had all the school age groups represented. So the first school, the middle schools and the secondary schools. Public Health Dorset obviously involved. The CCG, we had Health and Wellbeing Officer, we had Town Council, Active Dorset have been involved, health visitors, Mind. So it's been an incredible range of stakeholders and pretty much everybody has attended every meeting. So we met bi-monthly and sort of developed what we did. And we started with a bit of a brainstorm, and I apologise in advance for the next slide that's coming up. So Annie, if you could move to the crazy slide. I just wanted you to see that we kind of thought of lots of the aspects that impact on somebody's weight. So physical activity, mental health, finances, culture, knowledge, education, diet. And we looked at what we already had running, what we could tap into and how we could work with that. So really the yellow ones on that slide are the things that we've pushed forward. So we've been working with Dorset Mind Your Head. We've been working with, started off as a health and wellbeing reward card, which is what I'm about to expand on. And working with schools and their recipes, and also Sugar Smart. Now, at the same time, obviously it's really important that young people are brought on board. So if you can move to the next slide, we did a monkey survey, a survey monkey, sorry, it was a year 9 group in Thomas Hardy School. So it represents about, about 1,000 young people, couple of hundred young people that were asked to do this, and the teachers used their tutor time to encourage them to do it. So we had we know that school clubs, there's about 100 clubs that are provided at Thomas Hardy School in Dorchester, and we asked them if they go to a club and why. What prevents you from attending one of those clubs? Now, obviously, a lot of them will be physically active clubs, but some of them are science clubs or art clubs as well. Now, we were told that most wouldn't go because of they couldn't get home, but there are a lot of lunchtime clubs, and actually that only represented quite a small number. The main reason they didn't go to clubs was because their friends didn't go or they weren't motivated to go. So that gives us, it gives schools an idea of what they could be doing to improve on that. We also talked to the young people about their health and wellbeing, or the questionnaire did. So if you could move to the next one, Annie. So health and wellbeing, what pupils thought. So were they satisfied with their life? Only 7% disagreed. 66% said they were satisfied with their life. They agreed or strongly agreed with that. Were they happy yesterday? Again, nearly 2/3. So I was quite surprised with some of these results. I'm not anxious today. Well, that starts to come down. Only 50% really were agreeing or strongly agreeing. But coming up for 1 in 5 would say that they were anxious that day. And then I'm physically active enough to keep me healthy. About 3/4 said they were, and then about 1/4 said they weren't doing enough. So that helps us to kind of start to push some of our messaging. We then kind of thought about what we could do, and we thought, well, actually, we really want to, a tool that we've got are these school clubs, because every school's running them. So what could we do to encourage young people to go to their school clubs? So we thought about this reward card, a bit like a coffee club card, where you get 10 stamps and you get a prize or something, free coffee if it's coffee, but we weren't going to give away free coffee. It was going to be a certificate. And we met with a student focus group to sort of talk about what they felt about this, and they were really up for it. They thought this is a great idea, but they wanted the certificate to look really like official. So we didn't want a cartoony one or anything fun and funky. It had to be official looking, like we've invested in our health and well-being. So we came up with this reward card, we piloted it. It didn't go down quite so well, just because people didn't carry them around, even though they would sit in the back of their phones. So then one of the schools said, well, I tell you what, we'll put it into our school diary, and we'll use it there, because they all have to carry their school diary. So if you want to move on to the next slide, Annie. Thank you. So you should have a picture of my 5 ways to well-being. So we then worked around this 5 ways to well-being, because we know those 5 things are things that people can do to improve their mental health and well-being. So this is a prevention at scale piece of work. And schools will traditionally do a day's health and well-being, or a week. This is our health and well-being week, but it's not embedded in the culture of a school. And we wanted to start to embed it in the culture of a school. So it's normal to give, to say thank you for something. It's normal. They're keeping learning because they're in school anyway, but getting active, you know, what are we challenging our young people with, you know, on a daily, weekly, to get active? What are we doing in our classes to promote that? Are we standing up halfway through a lesson just saying, touch toes 10 times, or just doing something to get people active and building it as a culture within the school, as opposed to it's our health and wellbeing week. So we developed this poster. We know a poster isn't going to answer the world, but we developed the poster again with the young people, being in consultation. And so this has now gone out instead of the reward card, but this is also represented within their diaries. They've got, what amazed me was schools were prepared to say, we control 16 pages in our school diaries. We will give you 2 for health and wellbeing. So one is this poster, but as a black and white, it all had to be black and white. And then the other is a little sort of quiz that they do termly, to see how they're impacting on their own health and wellbeing. And then there's a reward card in there that they can get stamped, and they will get a certificate at the end of the year to say they've invested if they've gone to so many clubs. So if you could move on to the next slide, please, Annie. So in update, we've worked with the staff and student groups to embed health and wellbeing into schools. So posters have gone out, these posters have gone out to every single school. There's one in every single classroom to support that work. It's gone out, it's up in every single surgery in mid-Dorset. It's going out to the pharmacies. COVID has impacted us a little, but schools have embraced this, which has been amazing. We've enhanced it with the posters, as I've just said. We've developed a resource pack. So Mind and Active Dorset got together and have pulled together a lot of resources, and then worked with public health as well to pull together a resource pack to support teachers. If you could move to the next slide. Oh, on that slide, before you move on, you can see the 2 pages in the diary.
Oh, sorry.
It's all right, it's my fault. I suddenly thought, oh, I didn't explain the pictures. So the arrows and the post-it notes are the various focus groups, either on with the pupils or with the stakeholder groups. So sorry, Annie, next slide. You're doing an amazing job. I can't even see that you're doing it, and I'm just having to, yes, it's there. So in addition, we provided 5 ways to wellbeing training for all school staff that wanted it. And that is an ongoing offer, so that they can, if they understand what it's about, obviously it's easier for them to embed that. And I should say, in the resource pack, there's things for them to do in their tutor times, in their classes, work that they can carry on, and it's all split into the different age groups. There's also support if they feel there's a child that needs more support, or they would like some more information themselves. There's a resource set of where they can access more information and more help. We're currently producing a series of videos. So the bottom one is one of the GPs linking in with a school and actually giving an assembly on the 5 ways to wellbeing. We realised that with COVID as well, this is just not sustainable. We can't have, you know, it's been amazing. We've managed to link GPs up with their local schools, which has never really happened before. So that's amazing. But we've got the GPs doing 5 videos on each of the 5 ways to wellbeing. They can either be used as a whole assembly bolted together with a sort of intro and an outro on it, or all the video clips can be used independently, and they'll all be on YouTube, so that teachers can just say, right, we're going to think about being mindful today. We've got this video clip from that's your GP, someone that you actually know, doing this presentation. So we've got the videos coming through. Hopefully they'll be launched in January. And we've involved pupils throughout the process, and they're currently, this is another piece of work that's on hold because COVID hit us, we've got the pupils are designing 5 posters on each of the 5 steps to wellbeing, to go up and around the schools, and they'll just go up in the corridors everywhere, just to challenge people as to what they might have done that day to improve their own health and wellbeing and their own mental health. And then the next slide, I've only got a couple left, I promise. So just to show the stakeholders that have been involved in this whole process, well, these are the partner organisations, I suppose. We've got Live or Dorset that have provided the training for the 5 weeks to wellbeing. Obviously, we've got Mid Dorset as a primary care network that are doing the assemblies that are being rolled out. Dorset Mind Your Head have given us bespoke support sessions to the schools during this time, but also helped develop the resource pack. Active Dorset have been a great resource and working alongside them and helping develop the resource pack. We've obviously been promoting the Daily Mile and the use of that in clubs, and Sugar Smart. We've been pushing that, and schools and GPs are linking together to challenge each other on Sugar Smart. So I'm pretty much finished. If you could just skip the next slide, Annie, and go to the challenges. I just thought I'd summarise with the challenges. So the challenges we've had, time is always a challenge on anything, any project like this, particularly when you're pulling together a lot of different stakeholders. The timescale had to be very much dictated by the seasons of the school year. So for example, we suddenly realised to get the diary printed, to get the pages print ready, had to actually happen back in, I think, February time. January, February time. So suddenly, although they weren't going out till September, we had to kind of agree that and get that run through. COVID-19 has provided challenges, and there've been a couple of stakeholders that have been harder to engage and haven't been involved in the process, which is a bit sad. And then finally, the key learning points, really important to include the pupil's voice. It's for them we're here. It needs to be embedded in the school culture. All stakeholders pulled together and owned it, which was amazing. That was a really key part of this working. In places we use subgroups, for example, for the resource pack to move the project forward. We didn't all need to be involved in that. There were smaller subgroups that could be involved in that. We got the GPs engaged, which has been amazing, and we've shared what's been developed. And I would like to just end on my final slide with a quote from one of the teachers who's used this, and she says, "Thank you, this will definitely be used in tutor time this week, needed more than ever, I think." And I would just like to add my thanks for listening and my details, and the slide set will come out as a PDF if anybody is interested after this. That's me, done.
Well done, Naomi. So if there are any questions around any of that, we'd be very happy now or after today. If you want to either ask now or send a message to Melinda, she'll share it with us.
Yeah, that's great. Does anyone have any questions before Annie and Naomi?
Yeah, I do. I put it in the box.
I think there's one coming up in the box, possibly. Okay, so Clive's asking how many school pupils were impacted, do you think?
Well, we've hit every school in Mid Dorset so far with this, which I'm sorry, I should know the figure. It's a few thousand that have been targeted with it because it's Mid Dorset. But what's been lovely is the primary care network are not precious about owning the poster or resource pack or anything. So they're really happy for that to be shared wider and to be taken up by other schools. So there's no, they're not saying, oh, we pay for it, we own it, so it's fine. We would rather impact young people. As I say, I think for us, it was very much about embedding that within the culture of a school, which up until now often doesn't happen.
Yeah, and one of the other things that has come out of it is not just the impact on children and young people, but on the adults as well. So that's really been something, because we hooked up with Live Well Dorset, who offer certainly through lockdown 1, they had a 1-hour online 5 ways to wellbeing for adults session, and that was the intervention that we asked Live Well to support school staff with, so they could go on that. And actually it was really for them, and the training was really to get them to understand the 5 ways, but any adult could access that. But it was absolutely brilliant. And then it was from that when they then came to deliver the resource and the ideas to the children, that they'd already had something for themselves as well. So it's been, I think, because of COVID, that was a real boon, because prior to that, adults could access that, but it was at a cost. But through lockdown 1 particularly, that was free. Thank you very much.
Can I just say, if I share it with Melinda, if I pass on the links to the resources and the posters and things, then yeah, if you want to send it on, that's fine. That's fine by us. And then if you also want to share my email, I'll respond to any queries or pass on any more information. Just bear in mind, at the moment, like today, I'm on incidents reporting for COVID, so I wouldn't normally come out and be able to do this today. So I've just sort of said, look, I'm sorry, I've got to drop out. But
thank you, Naomi. Thanks for doing that. Okay, so if anyone does have anything they think about afterwards, or they'd like access to the resources, if you give me an email and I'll pass that on to you.
I've got one question, if that's all right. Hi everyone, my name's Jen. I'm from Sport in Mind. Thank you, ladies. That was really good presentation. Just a quick question that I'm curious about. How much, I'm assuming your project existed because there was a gap in the syllabus that of these kind of topics that they cover in schools. Is that, like, how much was that? How much were they kind of doing already, if anything? And then, yeah, where did your kind of project fit in? Does that make sense?
Yeah. So we haven't there, because it came from primary care, as a piece of prevention at scale work, which means it's something that it has to be a piece of work that is preventative in health, preventing health complications and for the longer term. And it came from primary care as opposed to from the schools. But the schools really engaged. I mean, we were amazed at how the schools engaged and got on board with it. So it wasn't really looking at a gap in their timetable so much as, yeah, we want to embed this within. So the posters, as I said, gone out, and the resource pack is very much about, so for example, in secondary education, they have tutor time every morning, and the tutor has about half an hour to fill. So they naturally, sometimes it's full because they've got news and views and stuff that they have to cover. But other times it's up to the tutor what they do or talk about. And some tutors just leave their kids to just sit there for 15 minutes and others engage. But I think if there's a resource and there's some things that they're being encouraged to engage with. So it's helped that all the heads of the colleges have engaged with it and have said, yeah, no, this is, and they're then filtering it down to their staff to encourage them to do it. So we do, at the moment, again, because of COVID, we haven't had time to go back and see how much staff are using it. But the fact that, so for example, let's say at the moment, I'm on the incidence outbreak line, which is coming in from schools all the time. Oh my goodness, what they're managing to deal with at the moment. It's like, if they've not, I don't think we can assess how much they've used it over this term, because it only came out October, was it end of September we released the resource pack, wasn't it, Annie?
Yes, September.
Yeah, so they've not had long to use it or look at it in a time when they're just trying to manage stuff that they've never had to manage before, and contact tracing and which children to send home and isolate, and why some numpty parents sent their child in coughing and sneezing, all over everybody. So do you know, we're in a weird time to assess how it's being used. But the fact that, so Kate Biddle is the head of one of the colleges at the secondary school, and the fact that she's saying we need this more than ever right now, I think it's hit one of the middle schools, one of the staff there. She is so passionate about it, and so she's been disseminating it and really encouraging the use of. But the way the resource is written, it can be used to blend in with if they were doing a science project or they're doing a game session, or, you know, some of it is just giving tips for a 2-minute mental health break, or, you know, activity mental health break in the middle of a lesson, because we know that research shows us that children engage more after even just stopping for a couple of minutes, doing an activity, doing something, and then sitting back down to their work. They will engage more and they'll get more out of the work that they're doing. So some of it is bringing in bite size, some of it is encouraging after school clubs. It's a whole, the resource pack's massive, isn't it? I mean, it's got a huge range of information, but we were working on a very, very tight, but very little budget really. There was no budget for the resource pack, so
I think, like you were saying, it's you've done the thinking and put everything together in a flexible way, so they've got the tools and it's easy for them to kind of pick and you know, mix and match things. So sounds really
sorry,
good.
I've wibbled on, but yeah, thank you.
Okay, thank you, Naomi. Thanks, Annie. If anyone else has any questions, I will.
Put my video on.
Yeah, I will pass you on to Clive. I will need to mute myself and probably turn a lot of things.
People hear me now? Good. Yeah. Guess I'm Clive Nelson. I'm the one of my roles at Active Dorset is workforce, and I'm really interested in with the Mind Hub because there's a massive amount of resources, and I think the last presentation really showed that. There's brilliant resources out there about dealing with some of these, getting mental health issues addressed in a whole well-being framework. It has occurred to me that the Mind Hub is around that link with physical activity, largely. And what I've been talking to Lindy about, and a few other people, is whether our next stage is to try and have some sort of sustainability around it by having a resource bank with us as well around the links with physical activity and good mental health. And I just wanted to share with people on it what they thought might be useful as a resource bank or signposting to key elements around physical activity that link with good mental health. And I mean, I can see Carla's on here because obviously we work quite closely in workforce and coaching with UK Coaching and Mind themselves, who are linked there, and also with Sport England. So there's quite a lot of resources on their site. I've got some stuff I can share on that if you want, but I've noticed that on the our Mind Hub page on Active Dorset, we've got a proposal to do a resource bank as part of the development of this Mind Hub. And what I was really coming in today say, what do people think should be on there? Should it be links to organisations that have got resources, or should we try and do some filtering of resources to say these are really useful links, these are really the best links, if you like, to public health, to mind, to some of the physical activity animations and videos that are around, showing where the use of physical activity to address good mental health as sort of central. Because the stuff I've just been seeing with Naomi and Annie is great, but it's quite wide, isn't it? And I'm just raising that as a issue because obviously with the 5 ways to well-being, one of them is of food doing more physical activity, which is what this hub is about. Is that my understanding of it? So I really want to just use this few minutes just to share with people, so you're going to have to talk to me now, about what you think we might do in this hub making a difference, because it's a big world of addressing mental health. And obviously the hub's really good for using for good practice and what people are doing on the ground. So I was fascinated by the 2 presentations so far, because there's one in Mid Dorset, There's one happened in Shaftesbury, which I know quite well. Shaftesbury, I used to teach at that Shaftesbury school. And I think it's really brilliant that people are doing those things on the ground. And I wondered how we could help all that with the Mind Hub, so people might come to its resource bank saying, well, there's the animations, there's the physical activity routes to good mental health. And I just wanted to share that with people and what they thought. Now, I don't know if you want me to show you a couple of those.
Do you want me to show you?
Yeah, if you want to put your, have you found it on OneDrive?
I found it.
Yeah. So this is, and I know quite a few of you will be aware of this, whether you are aware of this site. Yeah, yeah, that's it. So can you all see that? You better hide my slide, the other slides.
Yeah.
So what I'm going to just show you is the resource that UK Coaching do for that. If you're not aware of that, UK Coaching, do you want to go to the next one? It's something that we've worked with traditionally for quite a long time in Active Dorset and Sport England, which has two functions really. It's about participants in physical activity programs, but it's largely around how the coaching, whatever that word means, how the people who try to develop access and enjoyment and progression in physical activity environments, how they deal with ensuring that they fit everybody and are improvise and useful for everyone. And mental health plays a huge role in that. So if you go on their resource bank, I think there's over 150 resources and links to the effects of physical activity and sport on mental health. So if you go to the next one, for example, these sort of things is a resource for the workforce in physical activity across the country through coaching in this case. So it's just examples of the sort of things to do. These are the infographics and what they do. And there's also a number of really useful, there's a whole YouTube channel on this that UK Coaching use about why being physically active is beneficial. And it's probably stuff we all know, but it's again, it's how we communicate that and how we might store that and how we might act as a flag, a signposting structure, the Mind Hub, to this sort of, this is just one example. I'm not saying this is the only one. But these are the two, the ones on the screen now are public health and mind infographics. So I'll have a look at those. Welcome to comment on them. So it's what our workforce, the people that you may be in contact with, or you may be signposting people to. In the first one, the first presentation, be quite interesting if you're doing events around physical activity, and the people leading them are getting involved with this sort of stuff. I mean, this can look a bit like it's this sort of official position. It's not really. It's a sharing site, UK Coaching, that is working very closely with public health and mind and other mental health charities, and of course it also works with the government on advising on workforce development and coaching across the nation. Can you go to the next one? So these are the sort of things they'll do. There's the promotion. There's a great animation somewhere. I think I might have lost that one. On the next one as well. Yeah, and so some of what we try and do is, what does physical activity do? What does it mean? And therefore, why might it help? And that's a lot of work that Active Dorset does now. And it's that critical link with well-being and mental health. That what does it mean to be physically active? I don't know if you want to play either any of those. Yeah, just put the first one. So this is an example of the sort of things around. Is it going to let us do it? Control and click it. I thought I'd linked it up. All right, played online. Don't worry. I'll let you. Guys, I'll share this. I'll send this to you. but it's the sort of thing that if you're trying to get the people you're working with, or they want to go a bit further, or they want to know around this stuff, it's where we send them. It's where we encourage them to do. And there's a whole bunch of videos and resources and stuff on there, which many of you may have seen. I was just, yeah, that one. It's still not going to play us. Oh, all right. Why won't it play? No. Oh, not to worry. We've seen enough videos. Okay, thanks, Chris. Go to the next one. Yeah, I mean, it's just and the next one. Yeah, and it talks about all the time how coaches build positive mental health. So I'll put this. This is an example of a resource that I thought would be quite useful on the Mind Hub. This regional one, but come off that, and then I can go back on the screen with people. And I know the Youth Sports Trust has quite a bit of stuff on there. Chris is just leaving us, but and rather than us talking, or not just obviously the Mind is really useful for talking to new people, but it's also about what we would recommend when surely there's people ask us about resources. So can I just see what other people allow resource-wise where they go? Do people want to come in and say where they do? Jen, what about in Sport in Mind? You must use some of that stuff. Because you're linking with quite a lot of workforce as well in that, aren't you?
What do you mean in terms of coming up with sessions or?
In sessions and in actual people that you're trying to encourage to put physical activity and mental health together in their work. That's where my work is.
Yeah,
which is why I like this Mind Hub so much. Yeah,
we're actually in the process of putting together our own resources.
Right.
So we've just kind of looked at what else is out there and done our own take on it really. It's all the kind of things we're showing.
Right. So you don't think there's a value in having a resource bank that we all sort of signpost to, or should we?
I think it depends how much resource you've got to put into updating it, because it's useful if you can.
Absolutely.
It saves people time and it's a bit of a shortcut if you present, these are some really good clips. But it's then how do you update that and keep it?
Well, yeah, that's a good question. Well, I think it's through the partners, you see, because I tend to use this. I don't write my own. I know that Public Health and Mind and UK Coaching and other organisations are producing really good material. And it's almost, I want to say locally in our region, these are the places you go. And I'm just interested to know where if people are signposting to this sort of material, or if they're not, they don't see a use for it. Because there's a lot of material out there, a lot of really good material. It's just whether we have a role in the Mind Hub in steering that a bit regionally. Anybody else want to? Andrew, did you want to ask on that? Yeah.
So I'm the exercise instructor at St Anne's Hospital. I signpost kind of so many patients to different schemes in the community. My bankers fundamentally are generally kind of Dorset Mental Health Forum, Camford Cannon, so sports and leisure programme. There's the Unity League football programme, and then your kind of generic either exercise referral schemes, walking groups, and for kind of better, kind of higher functioning patients, they sometimes will kind of fall into your kind of more mainstream sports. But unfortunately, a lot of the time, there are kind of big kind of barriers of getting those patients into those groups.
Do you think the same messages are coming out from a lot of that material then? Do you think there's a consistency of?
I do think, sadly, a lot of the messages coming from this type of material and kind of the mental health element of it does focus to kind of your lower depression and anxiety and support networks, sadly. Even so much as I'm a kind of level 4 exercise and mental health specialist.
Yeah.
Spent 3 days doing a course learning about depression and anxiety, and not even touching on kind of bipolar and schizophrenia, which such a high proportion of our population suffer from and are kind of being affected by those real kind of comorbidities because of it, because of the sedentary behaviours and stuff. So,
yeah, sorry. Can I just ask your advice there? Because I agree. I mean, my understanding of it, I mean, I don't think we would argue, Active Dorset at Sport England, that physical activity is going to address some of those more challenging. It addresses the low level, if you like, if you want to.
No, and the preventative measures, certainly. I do think certainly kind of a better understanding of a kind of a database of people who have got experiences and understandings of people and kind of can work into that conditions, and also in terms of opportunities for kind of befriending and supporting for these schemes, and then trying to develop kind of more bespoke, smaller groups. It's always a question of funding, isn't it? But so a lot of my guys, for example, we've got a phenomenal kind of back garden at St Anne's, and I just kind of introduced some kind of adapted sports, kind of the beach tennis, the volleyball, building back the basic skills, and then that's enough for them people to take the step on. But when you look on a Google search or a Sport England search, if you kind of know what I mean, it just is literally written kind of all all sort of skills at levels welcome, but it doesn't necessarily mean someone can't pick up a back and stuff. I don't know, just to look a bit more together, kind of as a network of finding out sort of some of these different places and different areas as well.
Yeah.
Clive, who is the main audience for it? Is it kind of coaches and teachers and people who are running sessions, or is it users?
Both. UK coaching would do, but I agree it is still got a bit of a background of organised sessions. Right? Yeah, absolutely. So that may not be what I'm just trying to get to. Is whether us with a Mind Hub, you know, where is the most effective way we can use resources to develop contact, good practice sharing. That's all. I'm just when William said we was doing the hub today, I said, "Oh, come on! I just wanted to try and raise this because I think it's a very well, it's challenging, but it's also a very interesting area where we would what we would do. How would we be most effective?" I didn't know if Carla, you wanted to say anything from Mind's view on this. Because I appreciate there are great resources out there which we can draw on, and and it's brilliant that people are doing their own in a way, because that's a massive engagement process. But maybe I just get overwhelmed by the amount of stuff, and I say, well, actually, if I want to explain this clearly, this is where we go. Because yeah, some of my role is to try and get people to know. I know we promoted the course that Mind had done through UK Coaching, a big mental awareness course, a sort of 3-hour course, which is great. And this is sort of the some of the stuff around that. If you looked at this stuff, then you probably go to that one. So, I mean, we used to deal with a lot of coaches who were doing this sort of stuff, but now it is much more varied, and bigger problem, bigger issue. So I don't have any answers to this. So I'm just thought I'd bring it to you today to try and raise where.
No, it's good. Yeah, I've probably gone off on one as well.
Yeah, so. Um,
I do agree with Jen. I think it's if you had a place where all the resources would sit, it's who's going to manage that and how up to date are they. But what might be helpful is to have within the network at the moment, it's who sits on there. So if somebody wanted things specific to them that hooked into your world, Andrew, with the patients and people that you're working with, then they might know because they see you're on there that they might then connect with you. Similarly, if I wanted some of the Sport in Mind things, then I would go and I would connect with Jen about that.
Yeah.
No, definitely. And with active, sort of, I suppose you could link it to kind of active links on individual websites, for example. So sort of kind of Mind are always up to date on their Active in Mind kind of groups and where they're going. You go over to the link and they always keep up to date on that. No, certainly. Just putting it in.
Yeah, so you had a sort of infographic of organisations more than.
I would say that's probably an easier way to be reliant on the fact that everything will be up to date, because that's the thing.
Absolutely. Yeah, we wouldn't up to date it. We couldn't possibly.
And I think that's how Live Well Dorset operate their site as well. But it might be a conversation that we have with Live Well if to see how they do it.
May not be able to. I don't want to in any way take over people's role. I mean, Live Well are doing some of that. Yeah. Okay. It's just an interesting where we sit with that.
I think it's an important question, Clive. So it's really good to raise. And it is one that we probably do need to think longer about. But yeah, Jen, your point was right. I think I would agree with you on the keeping it up to date.
Yeah, no, I do.
I totally agree with that. And certainly if someone's got anxiety about attending a group and then it's not on for a given week or whatever, is something that does happen, and it can really kind of have much more detrimental effects to someone's recovery than.
Absolutely. This is why I'm just simply raising, we might just exploring what our best practice would be, if you like, in some people. Yeah. Okay. Brilliant. Thanks, guys, for that. I just thought I'd get us interacting a bit on what we were doing. So, Carla, sorry, did you want to?
Sorry, I was just listening to everything. I didn't want to. I didn't want to bit into anything. I just kind of agree with the fact that there is so much information and so many resources out there now for mental health awareness, and it can be really confusing to a new provider or a new coach to know where to go. And I kind of agree that having a pool of resources on a website is very difficult to keep up with, because people are constantly changing and adapting their sessions. So kind of what I kind of thought I'd share what some of the original networks have done. So they've created kind of a Google document which can be regularly updated and refreshed. And I guess all the partners that are involved in that network have that responsibility for updating the course. But they kind of came together to kind of bring it down to either 6 or 7 courses that everyone felt that were kind of the golden nugget courses that people had tried and tested, that everyone felt kind of comfortable in promoting. Otherwise it just gets very, very confusing. So I'm very happy to share that list with you from other networks, so you can see what courses that have been tried and tested at Mind, but then also tried and tested through our partners as well, if that would help. But it is all the kind of like giving everyone the kind of ownership to update it as they go along, rather than leaving one organisation and it kind of falling off a path. But yeah, don't know whether that was useful or not, but I'm happy.
Sounds like a great idea. Yeah. Okay. Well, I'll come off it now. I'll hand back to the chair. Thanks, guys.
Great. Does anyone have any questions or anything that they'd like to bring up that we haven't discussed today? I'm just aware of time. We've got about 4 minutes. So if anybody wants to say anything, now's your time. looks like we're all good.
If there's time, is that right? Hi everyone. Just to do a very, very quick intro, I'm Jen from Sport in Mind. We are a sports mental health charity based in Reading, but we're now kind of spread over, I think it's 9 counties. So we provide lots of different sessions to get people active and doing sport. Well, obviously one of the themes today about helping people's mental health by being active. So we have mainly done outdoor sessions over lockdown where we're kind of working on some online things. We do inpatient and community sessions, but as I say, at the moment it has largely ground to a halt because of COVID. For the reason you were saying, Andrew, about that consistency and, you know, helping people to have a bit of a routine. But just one thing that we are involved in, I just thought I'd mention, is Red January. I don't know if you've heard of it. So yeah, we are involved in that this year. So we're encouraging everyone to get active in January. As we know, it's a dark and long month after Christmas. So I just thought I'd mention it in case anyone is interested in getting involved personally, or you know anyone who might want to be involved, to sign up on their website. It's completely free to sign up.
Yeah, thank you for that. Okay, we lost a couple of people along the way because they've had to go on to other meetings, so I will let you go and stretch your legs, go and stand up, go and do some activity before your next meetings, and we'll catch up with you soon. Thank you.
Thank you.
Thanks very much, Melinda. Well done. Thanks.